I am Anindita Das, Associate Professor of Virginia Commonwealth University, Polyheart Center. I am mostly working on, my title of my work is mTOR signaling in cardioprotection and myocardial infarction in diabetic mouse and rabbit, and we are mostly working using diabetic mouse, which is type 2 diabetic mouse, and we saw that when we are using rapamycin, that is mTOR inhibitor, we saw that rapamycin significantly reduce infarct size of the mouse, diabetic mouse heart, and also when we use diabetic rabbit, that is the type 1 and type 2 diabetic rabbit, we saw the rapamycin significantly reduce myocardial infarction in diabetic rabbit heart. So, what is the mechanism we are trying to find out? So, we saw the rapamycin is mostly inhibiting mTOR-C1 complex by inhibiting phosphorylation of S6, and it induces phosphorylation of AKT, that is the serine 473, which is the direct target of mTOR-C2. And when we use rapamycin, we saw that cardiac apoptosis also significantly reduced after myocardial ischemia reperfusion. So, we in the diabetic rabbit model, we isolated lot of different microRNA. One of the microRNA, it is microRNA 302A, which is regulating anti-oxidative stress, anti-apoptosis and other stresses. So, we checked that microRNA. We saw the microRNA 302 is significantly reduced after infarction in control and also diabetic rabbit after ischemia reperfusion. And we checked that rapamycin significantly restored that microRNA. And one of the specific target of microRNA 302 is for P10, and which is regulating phosphorylation of AKT at 473. We noticed that microRNA 302 actually reduced in the rabbit heart after ischemia reperfusion in the diabetic rabbit heart particularly, and rapamycin restored that one, and rapamycin also reduced the P10 level in the diabetic rabbit heart, and that way it is actually inducing phosphorylation of AKT. So, the conclusion of our study is rapamycin protect diabetic rabbit heart by inducing 302 microRNA 302A, and which is inhibiting P10, and that way it is inducing phosphorylation of AKT, that is inducing the and protecting mTOR-C2 activity, and we can that is the major protective role of rapamycin in diabetic heart.